Hi, I'm Lauren Massey, physical therapist and board-certified orthopedic clinical specialist. I'm also the owner and clinical services director of Bay Area Physical Therapy and Lafayette Physical Therapy. Today we're going to talk about how to relieve carpal tunnel symptoms with PT. So what is carpal tunnel? Carpal tunnel is this area in the wrist, right here, where we have a lot of the flexor tendons that come down from our forearm that pass through a skinny area that's held down by a retinaculum, kind of like a ligament of sorts. Through that area, we also have the median nerve. So the median nerve is where we get most of our carpal tunnel symptoms. People often will report numbness and tingling, sometimes even burning into their hand. Most specifically, the first three digits, thumb, pointer, and middle finger, and sometimes a little bit of the fourth, but sometimes our lay people will just say, my whole hand is numb and tingling, and they don't know what to do. One of the things that we are lucky enough to have here is musculoskeletal ultrasound. So that helps us really make sure we're addressing the correct cause of the symptoms that someone is bringing forth. So with the ultrasound, I can look at the integrity of the nerve and see if it looks a little bit swollen, see if I see it tapering down as it passes through that canal there. And then we make sure that we're treating the right thing. Also, we have nerve conduction studies. Nerve conduction studies can ensure that we are seeing that it's coming from the wrist area. Oftentimes this can be misdiagnosed. Sometimes symptoms from neck nerves can refer things down the arm and into the carpal tunnel area and into the thumb and fingers. And people will say, oh, that's just carpal tunnel, where it might be a diagnosis from up above that needs to be treated in the neck. So once we ensure that we get to the root cause of the symptoms and we determine that it is carpal tunnel, we'll know kind of where to begin. Sometimes carpal tunnel is reported to be worse at night because we like to sleep kind of all curled up in a fetal position, and that closes down and can entrap that nerve into the hand. If that is the case, sometimes we offer the option for night splinting that can help hold your hand in a more neutral position to minimize that compression in that area. Another time people can feel carpal tunnel symptoms is due to pregnancy. When your blood volume increases to support the growing baby and their blood volume, the little artery that passes through that area swells as well, putting pressure on the nerve. Usually that type of carpal tunnel goes away after delivery. Other common causes of carpal tunnel can be due to poor ergonomics at your workstation. If you're typing and maybe resting your wrist or having your wrist in an odd position when typing on your keyboard, that can sometimes result in symptoms. Or if you're doing a lot of gripping activities, using tools for manual labor, that overuse of consistent gripping can lead to inflammation and irritation of those tendons that make them swell, taking up more space in that very narrow area, and thus irritating that median nerve. So again, as mentioned earlier, once we figure out the appropriate cause and the root cause of the symptoms, we can begin treatment. So in physical therapy, what might that entail? Well, we begin with stretching those tight tendons that might be passing through that area. Might be including some soft tissue massage work through the forearm, and then we look to strengthen. Sometimes it's actually strengthening of the lower arm, but more often we look at strengthening the upper shoulders and more proximal muscles of the arm that are meant to do more of the workload, so those little tendons and muscles in the hand and wrist don't have to strain so much to get the job done. Another treatment we're lucky to have here is a class 4 laser. So if you haven't seen one of our vlogs, we do have another vlog on our class 4 laser, which helps to decrease inflammation and reduce pain to allow you to better participate in physical therapy and get back to function easily. And most importantly, to make sure that this doesn't return, is activity modifications. We have to make sure that whatever led to the onset of this is handled. So again, could that just be a quick ergonomics check of your desk setup, or do we have to look at the way you use your tools or the way you play a sport? Either way, we want to make sure that we get to the root cause and we fix it and prevent it from returning. If you're interested in having physical therapy help you relieve your carpal tunnel symptoms, please call our front desk today.